introduce you to our afternoon facilitator, Dr. Steve Shortell, Dean Emeritus, UC Berkeley School of Public Health, and Blue Cross Professor of Health Policy and Management, and so many other credentials. But the one I want to emphasize is that he is the chairman of our technical expert group, and he's the one that's been really the wind under the wings of the Right Care Initiative. There's so many partners that are important, but there is no one more important than Steve Shortell. He knows what to make of the data, he knows what to make of the dissidents, and I think you'll enjoy getting to know him this afternoon. Steve, I'll hand it to you.
Thank you, Hetty, very much. We had a great morning, and our goal this afternoon is to keep the momentum going. And one of the things I want to challenge us with is, and I think Provella this morning teed it up and others as well, is each of us in this room should take away at least one, if not more, at least one idea that you are going to try to do and implement differently, okay, in your organizations where you have some accountability and responsibility tomorrow, okay? Maybe you can't get it, achieved tomorrow, but at least started, okay? So that would be my charge at least. A few introductory comments in terms of transitioning from the morning session that we had. These are sort of observations, and one we were just talking about at lunch. Why is it that we have the variance we've seen that Hector presented some of the data? A health plan in one state has its medical network and so forth right up there, and yet that same health plan in our state isn't up so high, right? So one of the things we have to remind ourselves, I think, is we're dealing not only with some difficult behavioral change, but it's an ecosystem of recognizing the provider and the healthcare team on the one hand, the patient and their family and the communities they're living in on the other hand, and that's an ecosystem. And that exchange is also taking place within often very complex organizations, who in turn are functioning under very complex regulatory systems in the United States, right? So that's what's involved with all of this. And one idea that might help us sort that out as we look at these innovations and so forth, we heard a couple great ones this morning, but how do we spread with some of the challenge, is core versus periphery. Core versus periphery. We need to figure out what is core to that innovation, that intervention, that care transition management program, that how we train community health, and periphery. That is, what needs to be flexible in order to be adaptable from one entity or unit or part of the state to another. And I think we sometimes get mixed up with people saying, oh, this is the core, unless you implement all of this, it's not going to work. No, figure out what it is that actually has to be replicated across all sites, all parts of the geography, and the rest has to vary. Okay, so why is it that San Diego appears at this point in time to do better than Sacramento or Los Angeles? Why is that? Well, yeah, we have to take into account and adjust for age, sex, and so forth and so on in our data, so we have to still do some of that. There's also very different community characteristics as well, but there's also characteristics of leadership, clinical leadership, managerial leadership, how we organize healthcare teams, etc., how we react to incentives, why we drag our feet. All of that needs to also be considered in order to be smart about adapting what works in one setting to another setting. And I think that is true of healthcare in this nation generally, but it's certainly true in terms of what we're trying to do with the Right Care Initiative. Second point I would just make that was made this morning, there are no silver bullets here. I think we know that. It's packaged. Think packaged innovation. The group of characteristics is going to make something work in one area versus another. So it's not just the idea, oh, isn't this a cool tool? Here we have email patients, diabetic patients, and we'll get them to, respond better, et cetera, et cetera. We don't do anything about, well, what about the receptionist's role in that? And what about the primary care physician? Does she even know about do they have a role in this? Is it just this care messaging kind of thing, for example? So we need to think packaged innovation. The final observation I'll make has to do with the election, right, of the past few days that took all of us by surprise. And it's really, how do you make the strange familiar? At the same time, making the familiar strange. And what I mean to say is, it was a strange event that happened. Many of us read it as strange, but how do we work with that and get inside of it somehow, where we make it where we can make it work? That's what I mean by that. Okay, I don't mean that we, become normalized to the views of the elected president that's been expressed so far. So let me be clear on that. But in terms of innovation, back to what we heard this morning, how do we also make the familiar strange? The familiar is what you all have been doing. Right now, we get reinforced for doing it. It's been the best, best practice in the past, but it's not getting us to where we need to go. So the idea of doubling down, I would reject. Doing what we're currently doing, just some harder, better, just work harder at it, I don't think so. I may be wrong, I just want to stimulate our thinking, okay? Rather, we need to start thinking about doing something different, something that's uncomfortable, something that may be strange. How do you make the familiar a bit strange? So with that, I just would suggest we think about those things a little bit as we hear the presentations this afternoon. And we're going to begin with Brian Bronson, and Brian's at Kaiser, where he's Chief of Family Medicine there and Director for Outpatient Care. And he's been a real leader at Kaiser for about 20 years, a real champion in terms of diabetes care. And he's going to be followed then by Adam Solomon, Dr. Solomon, and also Andrea DeCora. And they are both with Memorial Care Medical Foundation. And Adam has vast experience in working with physicians, also in change management, which is going to be very important. And Andrea, really the important role of a pharmacist. She also chairs the pharmacy committee for CAPG, California Association of Physician Groups. So Brian, we'll begin with you. Thank you.